Hello everyone, it gives me immense pleasure to welcome you all in this expert speaker program on urinary system health. So today we have with us Ms. Sapna Kamdar, who is a qualified nutritionist and a dietitian working in this industry for last 15 years. Sapna has helped thousands of patients have a good and a healthy lifestyle, all the while strengthening their renal system. So thank you very much for coming in the session today, Sapna, and we are really delighted and excited for this very educational session.
Thank you so much, Shweta, for inviting me here today, and it is immense pleasure on my side to come here and talk about a beloved topic which is so close to my heart on renal health and urinary tract.
Okay, perfect. So first of all, I would like, I would ask a very basic question to you. So looking at the, the statistics on a public health level, we are seeing a lot of health challenges related to kidney, bladder and the UTIs. So what's your take on this?
So Shweta, if you see in today's life, not only when we talk about the world population, but if we just look at India today, our own population, around say 25 to 30% of our population is affected with various disorders related to kidney, urinary tract, and a lot of urinary tract infections these days you see in women especially. So you see the prevalence of renal disorders have been increasing, the numbers have been increasing alarmingly high these days in young people suffering from comorbidities and lifestyle disorders due to their unhealthy lifestyle, their unhealthy eating habits that they have. All of these add up to an existing comorbidities like diabetes, hypertension, as we all know, are the root causes of these kind of complications related to kidney and bladder, Shweta.
Yeah, so also I was going through a survey which said that 1 in 10 men suffer from UTIs and 1 in 4 women in India, they are suffering from UTIs. So yeah, it's a huge number. So especially when you see the female population is much more affected by it, right?
Right, yeah. So when it comes to UTI, I can say the number of incidences are higher in women compared to men, but besides that, there are other urinary bladder problems that men go through. When it comes to poor hygiene, poor water intake, we women tend to neglect our health. We take care of the family, we tend to forget taking care of our own selves or drinking enough water, taking good amounts of fruits and vegetables in diet, following a good routine, hygienic practices that needs to be followed. There are certain exercises for your bladder that one needs to do, to keep your bladder health wise and correct for a longer period of time. So yes, what you're saying is absolutely right, Shweta.
Yeah, so also, the vaginal lining and the urinary lining is so close in female that tends to a lot of more infection as compared to male.
Absolutely, right? Absolutely.
And also I have seen on an overall, if you look at the Indian statistics, 17% of the Indian population, they are suffering from kidney related health challenges. 25 to 30%, as you mentioned, are having like kidney stones, etc. So it's a huge number and it is like an alarming cause of concern. When you look at these statistics, these are completely shaking, right?
Absolutely, absolutely.
So which kind of patients, do you get on a regular basis when it comes to renal health overall?
So we see a lot of renal related issues in terms of CKD, chronic kidney disease. We see acute kidney injury patients. Renal stones are very common these days. We see certain congenital renal disorders coming to us, renal cancer patients coming to us, and the most commonest I would say CKD and urinary tract infections with long-standing uncontrolled diabetes. So these are some of the disorders that we deal in, day in and day out. Secondly, I would like to say that more of young people are falling prey to these lifestyle disorders these days. Again, the lifestyle and the eating patterns, to be blamed for. But besides that, there are certain inherited diseases like renal stones. Suppose if your mother and father, anybody of you in the family have a history of renal stone or a history of renal disease, you are at a higher risk of of developing those disorders later in life. अगर आपने शुरुआत से ध्यान नहीं रखा तो you are going to be falling prey to that disorder later or sooner in life. So it's very important that you take care of your organs, your bladder, your kidneys right from beginning, to delay it or rather prevent it in a way. Yes.
So can you tell for our audience what are like the dietary changes and what are like the lifestyle modifications that we need to do when it comes to urinary tract health?
Yes, so it's very important, first and foremost thing, that we need to take care of our bladder health. As you rightly mentioned, that the vaginal lining and the uterine lining is very close by, so the chances of infections are very high, with related to urinary tracts. Also uncontrolled diabetes, the blood sugar rising in patients or people, they don't take care of their sugar levels, fluctuating sugar levels, and you see the deposits of sugar crystals being in the urinary tract, which causes a lot of yeast infection and thriving of harmful bacteria in the tract, causing a lot of pain while urinating, or lower abdominal pain. You would see sometimes even bleeding. These are some of the signs and symptoms that you would have. Micturition or inconsistency in while passing the urine. So besides that, the muscles of the uterus needs to be taken care well of by eating good amounts of protein, by following certain hygienic practices, as I mentioned before, as well as certain Kegel exercises that can be done, especially for women, for taking care of the bladder, and of course, following a good healthy diet, free from processed foods and junk food, hydrating yourself well, that really helps in flushing out all the toxins and the harmful bacteria from the tract. That would really help. Maintaining a good pH in that private areas are very important to keep your bladder healthy and fine.
So what do you think about the the intimate washes, and is it really good to maintain good hygiene?
So of course, not everybody uses it, but then if we follow simple basic principles like keeping the toilets clean, the toilet seats are wiped and kept well, or while you are urinating in public places, toilets, take care, taking care of your hygiene, personal hygiene that way, either you're traveling or sitting well, the positions that you are in, or completely vacuating your bladder while urination. Some people have that, in a hurry they would just get up and go and not clean the private areas. That could lead to we go through menstruation, women go through menstruation. During that period, it's very important that you take good care of your private parts during those time of the month. And besides that, as I told you, hydration is the best way, and certain washes that help us to maintain the pH of our areas are really important to keep the harmful bacteria away from causing any infection or harm to us.
So, like a lot of people who are frequently traveling, they should make sure that they are going in clean toilets.
Yes.
And also, if not, they should be using cleaning the toilets first and then using it.
Absolutely.
Apart from it, having good hydration, eating good nutritious food.
Absolutely.
And what else would you recommend for having a great urinary tract health?
So again, as I said, eating good amounts of protein to maintain the muscle health of the bladder, and there are some exercises that you can follow over the age for the bladder, that can help us, and basic cleaning practice that you would follow.
Okay, so how about kidney health? Which kind of patients do you get when it comes to kidney health, and what are the dietary interventions and lifestyle changes that you suggest them to maintain a overall good kidney health?
So kidneys, sadly I would say, Shweta, that they have been taken granted for. We always focus on the major organs of our body and we overlook the kidney health unless and until we have those alarming blood reports showing high creat and high uric acid on our reports when we see them. Because kidney does kidneys do lot of important functions in our body, and not just helping us filter out the toxins or filter out the waste products of our metabolism or the food that we eat, but also it helps in building the making hormones, important hormones, maintaining the fluid balance of our body, maintaining electrolyte balance of our body, making certain hormones, maintaining calcium and vitamin D homeostasis in the body. So it plays kidney play a very important role in our body, and sadly they are taken for granted or overlooked unless and until something alarming happens. Now when it comes to kidney disorders, we see a range of disorders that I already mentioned. We have CKD, AKI, but sadly they come to us at a very later stage because diagnosis nahi hota hai. So if you are a long standing diabetic, say over for 15 years, 20 years, or you have hypertension, BP है आपको इतने सालों से, तो it becomes very important कि आप renal के test भी करवाएं. Every 6 months, every year you do that body checkup to see whether your organs are working efficiently, functioning well or not. Unless and until there are patients who come to us with a creat of 11, directly with a creat of 11. So yeah, so the physician has never asked them to do a renal function test. So that's how, the diagnosis is very late, and that's how we are in not that position to help them as much as that we can help them in the earlier stages.
So basically the people who already have comorbidities,
yes,
diabetes and high blood pressure, they should make sure that they are getting regular medical checkups done.
Absolutely.
To check out if their kidneys are not getting harmed, right?
Yes, absolutely. Because
now what do you think about the immunity and the health of the urinary system? Is it like connected?
Absolutely, it is connected, because all whatever damage happens to our organs could be because of a poor immunity. So all the bacterial infection, all the viruses, whatever you say, they attack only when we are less of a defense in our body. So whether you talk about vitamin C, whether you talk about antioxidants, whether you talk about probiotics, prebiotics are talked about so much these days, and how well we all know it since the COVID time how important the immunity the word has become to us. So that applies and implies to every part of our body, not just one particular organ, but of course every part of our body needs to be taken care that way.
Okay, that's really amazing. So to have a strong immune system is very important to maintain overall health, as well as the health of your urinary tract. So Sapna, I would also like to ask, so looking at your background, you must have helped so many patients now with renal health related issues, right? So what are the kind of supplements or supportive therapy you're using for your patients on a regular basis, and how do you think it helps them as a supportive therapy in their overall dietary management, in their overall lifestyle that you give them or you recommend them?
So besides the medical treatment that the patients are taking, as dietitians, as qualified dietitians, we always encourage our patients to follow a good dietary advice that we give, limiting the sodium rich foods, hydrating well, taking care of your potassium intake, your fiber, your protein, and limiting the processed foods in your daily routine. So these all things really help, and besides that, as you rightly mentioned, we need some supportive therapy along with the dietary interventions that we recommend to a patient. So we use a lot of green teas. There are a lot of herbs that are really beneficial in helping in flushing out the toxins from our body, helping to maintain the renal health, the health of the kidneys by detoxifying the metabolites or the unwanted medications or toxins that we ingest in every day, so it helps in flushing out those toxins out of our body, as well as maintaining the function of the kidney. So there is maybe cranberry juice, you have antioxidants, you have probiotics that I mentioned just, that they really help in maintaining the metabolites that are produced from the microorganisms in our body, that really help to maintain the function or the overall health of the bladder as well as the kidneys. Yeah, so these are some of the ways you can really support your dietary intervention and the medical treatment that you're taking.
Yeah. So cranberries and blueberries, when you look at, they have been used since years for like managing your urinary tract health. So we also have launched a product which is named as KBU. So as the name suggests, it is for the kidney, bladder and the urinary tract. So this product is from 4Life and it's from our targeted transfer range. That means it is targeting a particular organ system. So this product is something which targets your kidney, bladder and urinary tract. So it gives you a comprehensive support for your urinary systems in the body. So as you rightly mentioned that immunity is very, very important. So we also have transfer factors in it, which is like the most unique thing in all our targeted range of products. So transfer factors are like these proteins and peptides from cow colostrum and chicken egg yolk, which have this capacity to enhance and educate your immune system so that it can like perfectly recognize, respond and remember any potential health threat. So when it comes to immunity, when the immunity is good, each and every organ system works properly, and that is what the core science is behind all our products when we speak about it. So this product is something which is going to help you with your immunity. Then it has, then as you mentioned, cranberries. So we have cranberries, we have blueberries in it, we have D-mannose, which is an amazing ingredient. It will like take off all the bacteria and it will try to flush it off from your urinary system. Then we have Bhumya Malaki in it, which is like a stone breaker. We have Varuna, which is again a very powerful Ayurvedic botanical extract which is used in this product. And also we have some salts in it, with minerals in it, which are going to help you have a healthy urinary system overall. So basically this product is going to work on your kidneys to maintain a healthy filtration, for your urinary tract to maintain a healthy urinary lining, and of course it is going to give you a good urine flow. It is going to maintain the pH. So and also for the bladder, it is going to help you with the bladder tone. So this product is not going to treat, cure or prevent a disease, to be very clear, but it is going to work as a wonderful supportive therapy.
Right.
So this is going to help you with your bladder tone, for maintaining a healthy pH, as you mentioned, is a very important aspect when you look at urinary system health. And also it is going to help us with good urine flow and the filtration process. So this is something which is going to cover all the like the overall urinary system. So how do you feel about it?
Wow, that's really sounds amazing, Shweta. The product really seems to be very, the composition looks very comprehensive, and I'm sure it's going to really be beneficial to people, looking forward to maintaining the health, kidney, bladder and urinary tract health. So it looks really good.
Perfect. So also as you mentioned that you also suggest to a lot of your patients about prebiotics. So what's your take on that?
So probiotics, as I told you, they play a very important role in maintaining building the immunity of the system, maintaining the health of our organs in our body. And there have been studies which have proved the effects of metabolites that are produced by probiotics, and they help in maintaining the kidney health and the urinary tract health in people, taking them on a regular basis. So may it be in the form of natural probiotics to exist karte hain in our Indian diets, as you all aware. Curd ho gaya, fermented foods ho gaye, certain fermented veggies that we prescribe to our patients. Besides that, there can be supportive therapy of probiotics that can be given to the patients for better results and for its effect.
So Sapna, we also have probiotics in our range, and the best thing, it is a combination of pro and prebiotics.
Oh wow.
So apart from that, it also has transfer factors in it which are going to balance your immunity in a very, very big way. So a combination of pro and prebiotics and transfer factors is going to do wonders when it comes to immunity, your urinary tract health and also your gut health. So when the immunity is good, overall functions work properly. Absolutely. And especially when it comes to urinary tract health, immunity is a must. Good immunity is a must. So as you spoke about studies also, so we also have a study on this product which said that when we combine prebiotics along with transfer factors, it increases gut bacteria to a very dominant number, And it helps in, it has a number of probiotics added to it, which are going to help you give a good immunity and good gut health, and also when the immunity is good, it is going to directly help in your urinary systems as well. So I would also like to ask you, what's your take on vitamin and minerals when it comes to, like suggesting to your clients?
So when we talk about renal disorders, Shweta, we know that they suffer from various deficiencies, because kidneys are the main organs that they convert vitamin D into in its active form. They maintain the calcium and phosphorus homeostasis. There is iron deficiency seen in most of the patients. We also see deficiency of vitamin D in these patients. So we on and off try to balance out their meals in a way to incorporate all of these vitamins and minerals, try to give them a balanced diet. But again, as you see, the patients do not have much of an appetite to eat sometimes. The patients are elderly. The absorption rate of these vitamins and minerals from the food gets lower, plus their gut is compromised. So all these factors contribute to a lot of deficiencies in them, and that's the reason that doctors and at times we also prescribe a certain helping supplements, calcium supplements or multivitamins that really help them to maintain their nutritional status, because malnutrition is something very common in renal patients. Yes.
So the absorption is poor because of the age and a lot of other factors, the kind of food that we are getting, so they're not getting good amount of vitamins and minerals. So in our range, we also have this vitamin and mineral complex. So it gives 13 vitamins and 14 minerals in a 1-pack solution. So it can be good for any person. I think everybody should take this, because the the kind of food that we are eating, the lifestyles that we have, this is an amazing go-to product for everyone for managing their overall micronutrient needs. So so basically from your talk, I think I can summarize that healthy food, healthy balanced
absolutely
meals, and exercise, good amount of physical activity along with supplements gives you a comprehensive protection against your renal system, right?
Absolutely. There has to be an holistic approach that we should take towards maintaining our KBU health.
Sapna, my last question to you is, I would like you to mention 5 key away do's and don'ts to maintain the KBU health, the kidney, bladder and the urinary tract.
Yes, so as we all know, the systems, the KBU is so well interconnected and its health is important. All 3 systems are very important for our body. So of course, eating a well balanced diet, drinking enough water so that it helps in flushing out the toxins from our body, exercising, moderate form of physical activity, taking care of your bladder health, Kegel exercises that needs to be taken care of, following good hygiene and cleanliness practices for your private parts and for your bladder health. It's very important. Don'ts, as I would say, avoid unnecessary medications, antacids, bombarding your body with unnecessary junk food, processed foods high in sodium, fried foods, fatty foods. These can be avoided to maintain the overall health of your kidneys. Do not put more load on the kidneys. Do not make them work more by eating high protein or high animal, more number of animal foods. So these are all pointers that one needs to keep in mind when they are talking about the KBU health, Shweta.
Okay. Superb. So I think these were wonderful key messages for the audience. So thank you very much, Sapna, and this was really one of the most educational sessions that we have done. Thank you very much for your time.
Thank you, Shweta, for inviting. Thank you so much. It is my pleasure.
Thank you. Bye-bye.
Bye.